we are going to deal on most important topic, so that is hypothyroidism. Okay, so before going to hypothyroidism, so we should know some common and basic concept related to the hypothyroidism. In a normal individual, what happens here? Thyroid glands make so the different hormones, so the T3 and T4 and TSH. So these hormones are very important for growth, development, as well as reproduction in human beings. But during some conditions, what happens? So thyroid glands not able to produce them, so that is the sufficient amount of T3 as well as T4 hormones and as well as TSH hormone. Okay, so it may lead to so the conditions that is we call as hypothyroidism. Yes. Now come to hypothyroidism. Hypothyroidism also would be called as underactive thyroid glands. Underactivity of a so thyroid gland. Here, so now come to the meaning. What it means? Hypo means very low. Thyroidism means thyroid glands produces insufficient or a absence of so that is thyroid hormones. Now come to the definitions. Here, hypothyroidism is defined as it is an autoimmune disease, okay, so resulting from so that is insufficient amount of so that is T3 and T4 levels. It may lead to weight gain, so that is tiredness, fatigue, obtications, so as well as so the bitterness. Okay, so based on so these signs and symptoms, it is diagnosed as so that is hypothyroidism. Here, in a simple way, hypothyroidism is defined as it is an autoimmune disease in which so the individuals develop fatigue, so that is loss of hairs as well as weight gain, so resulting from so there is the decreased production of T3 as well as T4 levels. Okay, so this is regarding the so that is definition of so that is hypothyroidism. Now come to the so the types of hypothyroidism. Here, it is depending upon the involvement for the production of so less hormones. It is divided into three types. One is primary, another is secondary, another is tertiary. Here the primary what happens itself to the thyroid gland. Here thyroid gland is not having so the capacity to produce so the T3 as well as T4 hormones. Okay, so that is it is problem related to the thyroid gland itself. Here now come to the secondary, so that is so the secondary so that is hypothyroidism, in which the pituitary gland not able to produce TSH hormone, so the thyroid stimulating hormone. When there is no thyroid stimulating hormone, so thyroid glands are not stimulated, not produces any kind of so the thyroid hormones. Okay, so it is the regarding to the secondary hypothyroidism. Now come to the tertiary hypothyroidism. Here the thyroid glands and the pituitary glands are so that is normal, but the hypothalamus not able to produce a thyroid releasing hormone. Okay, so thyroid releasing hormone is very important for functioning of a so thyroid gland as well as pituitary gland. Here, so that is hypothalamus is not processed, so that is thyroid releasing hormones. Okay, so this is depending upon the so the involvement, it is divided into so three types. One is primary, secondary, and the tertiary. Now come to the causes. Here the different causes for this, so that is hypothyroidism. Here one of the most important cause for the hypothyroidism is Hashimoto's disease. So what it means, Hashimoto's disease? It means Hashimoto's is a person's here the doctor, so that is Dr. Hikaru Hashimoto's. He studied so regarding to this condition in the year 1912. Okay, so for that reason, it is the name given as a Hashimoto's disease. It means that is thyroiditis, autoimmune thyroiditis. Here, usually, so what happens? Our body having a resistant capacity, our body produces antibodies when response with the antigens or foreign materials like so the bacteria and viruses. Here, our body, what happens in some conditions, our body antibodies so attack on our body own cells. It may causes so the disease conditions. Those diseases would be called as autoimmune diseases. Here in the thyroiditis also, the hypothyroidism also happens the same only. As our body cells attack to the thyroid gland cells, it causes so that is the destruction of so thyroid gland cells. It may lead to insufficient production of so that is thyroid hormones. It is a purely autoimmune disease. Now come to the so that is clinical manifestation of hypothyroidism. Here the further so that the easy remembering. So I conclude that the word so that is fat, cold, human, BP. Okay, so F is nothing but a fatigue. F is nothing but it is a fatigue. E is nothing but it is amenorrhea. So that is loss of or cessation of menstruations. So the T is nothing but thinning of hair or partial or complete loss of hair. The C is nothing but the cold intolerance. The O is nothing but it is so that is obesity. So L is nothing but lethargy. D is nothing but a dryness of a skin or a dizziness. The W is nothing but it's a weight gain. So O is nothing but it is an obstications. Obstications, it is a severe form of constipation. So there is M is nothing but menstrual problems. A is nothing but amenorrhea. So that is anemia. Okay, so that is hemoglobin level reductions. The N is nothing but that is nails brittle or easy to break nails or nausea and sugar vomiting. So B is nothing but the persons who are suffering from sugar hypothyroidism, always they have bradycardia, so there is low heart rate as well as puffiness of face. Okay, so these are the different clinical manifestations who are going to see the persons who are suffering from hypothyroidism. Now, so diagnostic evaluation, how we are going to diagnose the so that is hypothyroidism. Yeah, some of the diagnostic the measures are there. So physical examination, the hysterectomy is very important, and also the thyroid profile check. You are going to do blood test and CT scan, MRI. Okay, also that plays a very important tool in diagnosing it. So that is hypothyroidism. Now come to these complications. If we are not treating so the hypothyroidism in a proper way, means what happens? So that is quite an enlargement of thyroid gland takes place, and okay, so miscarriage. Suppose the person, the humans are pregnant means there is miscarriage takes place. Because thyroid gland plays a very important role during the pregnancy. If there is no thyroid gland means definitely the miscarriage will take place. So now come to the so that is infertility. So it means inability to conceive, inability to bear a child or things. So that is we call as a so that is infertility. So now come to the so that just to see so what is incidence about the hypothyroidism in India. So the 40 over a year in India, so that 42 million people were suffering from so that is hypothyroidism. It means 4.2 crores people suffering from so this kind of hypothyroidism. Now what is management for so that is hypothyroidism? Here one of the most important so that is management aspect is so that is hormone replacement therapy. So that is the replacement of leothyroxine is the most important so that is treatment options for the persons who are suffering from so that is hypothyroidism. Okay, so this is regarding to the what clear cut information about hypothyroidism.